Hey guys, we'll be starting the quiz at 10:10. 2 minutes to go. Today is ENT finale. You can join the quiz by scanning the QR code shown on your screen, or you can just go to our slide and put the code, that is 698J1.
And those who are watching us on YouTube Live, you can join us uh, to the quiz. So let's do this one last time for ENT. So please come and join.
You've got to join if you're watching. I mean, you should know what you know and what you don't. And since it's a negative mark, no negative marking, there's no harm in doing it as well.
Yeah, it will be a good revision also.
As you know, the date of NEET 25 has been released. That is 15th of June. So we got to be prepared.
Okay, 1 minute to go.
Let's get started.
Okay.
All right. So guys, welcome to NEET. What? All right. So let me go again. Uh, Welcome everyone to you. People will call you as NEET warriors now on. So let's go. It's time for another high yield Juxtamed quiz. Today we will be testing your ENT knowledge. We have 20 questions, exciting ENT anatomy, and all about it lined up for you. And let's see how your sharp skills come up with. So let's begin. So your first question on your screen is, a 60-year-old child presents with mouth breathing, snoring, and recurrent episodes of otitis media. On examination, the child has high arch palate and adenoid facies. What is the most appropriate next step management?
So
What
here
do you
the
want?
child may have a nasal voice due to
Yeah,
the airway obstruction.
and remember if
Easy
it
question
is
to start with.
yeah, remember if it is serious, we often go for surgical options. Perfect. All right, guys. So you seem to have picked up the pace. Let's move on to your next question.
Okay, a 55-year-old male presents with progressive worsening hoarseness of voice for 3 months. He has a history of smoking for 30 years. Indirect laryngoscopy reveals an ulcero proliferative growth involving the vocal cords. So, what is the most likely diagnosis?
So since you know the patient has a history of smoking as well, and then ulcerative proliferative growth as well, what are you gonna do?
Right.
Okay. What would you go for if like the question for you guys is like what are like the which classification would you go ahead uh, with it?
Okay, we have Myra, RK, RDT, Shanpriyan, and Juju. Okay, hardly 1 or 2 or 3 points difference.
So question is, A 25-year-old male presents with unilateral nasal obstruction, recurrent epistaxis, and a mass in the nasopharynx. CT scan reveals CT scan reveals a locally aggressive tumor arising from the posterior nasal cavity. Which of the following is most likely diagnosis? Remember, it's posterior. So,
Yeah,
what,
this tumor is exclusive to adolescent and young adult males.
and usually biopsy is contraindicated due to high risk of bleeding.
Okay, we have a variety of answers here. The one important clue was recurrent epistaxis.
Hmm.
Okay, and unilateral nasal obstruction.
That is sufficient.
Okay.
Yeah. So moving on. All right. So guys, let's keep the pace up. You guys are doing great. It's not the end till the end.
Okay. Yeah, a 45-year-old male presents with complaints of progressive hearing loss in the right ear over 6 months, associated with imbalance. There is no history of pain, ear discharge, or tinnitus. MRI with a contrast shows a well-defined enhancing lesion at the cerebellopontine angle. What is the most likely diagnosis?
So you have the negative history and you have the positive history as well.
Yeah, you have the important to CP angle. That's enough.
Right.
Okay, they got it.
To anyone raising their hands for any reasons, you can just let us know in the YouTube comment section. We will address it. So your next question is: a 60-year-old male chronic smoker presents with progressive dysphagia to solids, weight loss, and intermittent regurgitation of undigested food. Varium swallowed reveals a both big appearance of the esophagus. What is the next best management? I think this is a
Yeah, this is
self-explanatory.
what you asked before.
This is very self-explanatory. So,
Okay, 14 of them have chosen manometry. I think manometry is for a different reason, to check the pressures in the esophagus.
mm,
This here the question is asking about the carcinoma.
right.
We have Aki the quiz, followed by Bhagya, Myra, Dr. Reed Star, Juju, Sriraj, Shanpriyan, Paramuragan, Soumya, LB, Thor S, PK, RTE, Navi, Hemant, Aisha, PKSN, and Srirama. Okay,
Great going,
let's
guys.
see the
Great
sixth
going.
question. A 40-year-old male with taxes and serious otitis media. On examination, there is a firm non-tender mass in the nasopharynx. MRI shows a locally invasive lesion extending into the skull base. Which of the following is the most likely associated risk factor here?
Okay, so we're asking you the risk factor.
Yeah, so you have to make a diagnosis and then see its risk factor. Yeah, right. Can you tell us what is the diagnosis for this question?
And also, where is it commonly found?
Okay.
So your next question is a female.
Okay, a female has progressively enlarging neck swelling over 6 months, associated with hoarseness of voice and difficulty in swallowing. Examination reveals a firm, non-tender, fixed midline neck mass that moves with deglutination, but not with protrusion of tongue. So which of the following is the diagnosis?
This condition commonly arises from a thyroid tissue. I've given you a big hint.
Oh, this is a good trap. The question had that moves with deglutination, but not with protrusion of the tongue. So,
Mm,
so the second half was important here.
right. So keep reading the question, guys, properly. You'll get it. All right.
Okay,
So
not
we
much change.
Arcade leading the longest streak, followed by Sri Raj and Myra. Your next question is 28-year-old male presents with nasal obstruction, epistaxis, and insomnia for 6 months. Examination reveals a fibril polypoidal nasal mass. Histopathology shows small round blue, blue cells with necrosis and positive for synaptophysin and chromogranin. What is the most likely diagnosis?
So as you can see, it is a neuroectodermal cells. Yeah, it is olfactory nasoblastoma.
Wonderfully done, guys. Let's keep up the pace.
Okay, a 40-year-old male presents with progressive unilateral hearing loss and intermittent pulsatile tinnitus. Audiometry shows a conductive hearing loss and a carotid pulsation affects the intensity of the tinnitus here. So, what is the most likely diagnosis?
We are asking you the most likely diagnosis over here.
Right. The image is also very clear.
Yeah.
Yeah, most of them got it right.
For me, yes, it is such a sensory hearing loss. No?
Okay, we have RK leading the quiz from a long time. And we have Sriraj in the second place, Myra in the third place, followed by Soumya S, Dr. Reed Stark, CK, E, Juju, and Shanpriyan.
E. Right. All these alphabets come along. All right. So your question is a 25-year-old male presents with fever, sore throat, dysphagia for 5 days. Examination shows bilateral enlarged tonsils with exudates and cervical lymphadenopathy and thymus. On attempted examination, the vulva is deviated to the right. What is the most likely diagnosis? So the patient is
So,
experiencing
yeah,
fever, sore throat, and dysphagia. Bilateral tonsils are also there.
yeah, it is peritonsillar because the important clue here is uvula is deviated to the right. It is
Right.
classically seen in peritonsillar abscess.
Usually, guys, you should focus on classic findings, like what is going to happen in what condition. That is how it helps. All right, so let's move on to the leaderboard. Ah,
Okay, Sriraj is leading now.
great going, guys. Great going. Remember, the competition is always going to be cutthroat. So let's move on and let's keep the pace. Your
Okay, a
question.
50-year-old female with a chronic smoker presents a deep, husky voice that has gradually worsened over the past years. Laryngoscopy reveals bilateral translucent gelatinous swelling of the vocal cords. So, what is the most likely diagnosis?
The condition is commonly seen in professional voice users. And tell us the management also.
Let's see. Yeah, the right answer was none of the above. Can you tell us the diagnosis here? those who are watching us on YouTube live, you can comment it down. So the diagnosis was Rinke's edema.
You could have waited, no?
Yeah, I think we often neglect no the none of the above option. We often think the answer will be here.
Hmm. Right.
So it was a good trap, I guess.
I guess so too. All right. Let's see how the
Yeah,
link is.
Ramakrishna is right.
Hmm.
It's Rinke's edema.
Great going, guys. Great
Okay.
going. Let's go. So your next question is: a 45-year-old male with history of chronic ear discharge presents with headache, fever, and altered sensorium. Examination reveals nuchal rigidity and papilledema. A CT scan shows an erosive lesion in the mastoid with ring-enhancing lesions. What is the most likely underlying cause? Hmm. Let's see if you
So
get
this
it.
condition,
Yeah.
yeah, requires urgent IV antibiotics and drainage.
Hmm. What do you what do you do? What is the diagnosis? Right. First, is well
Okay.
done. So
12 of them have chosen tuberculous meningitis.
Cuba.
Okay. It's good to confuse you.
Okay.
Okay. A male with chronic ear discharge presents with sudden onset facial weakness on the right side. He is unable to close his right eye and there is loss of forehead wrinkling. Otoscopic examination shows a posterior superior attic perforation with granulation tissue. So, what is the mechanism for this condition?
Remember, the infection has spread to a nearby cranial nerve. That is why we say there, that is why the question it says at onset of facial weakness on the right side.
Yeah, it is due to direct invasion of the facial nerve by cholesteatoma.
Wonderfully done, guys. Let's keep the
Okay, yeah, continue.
let's keep the pace up, guys. You're doing great. We have PP who's rocking the longest streak, and then Sriraj who's leading, then Myra, then Soumya, then Anke. So great going, guys. Dr. Reed Stark, then Juju. Is it a good Juju or like a bad Juju? Then we got E, then we got RDT, then Aisha. I'm gonna call him Kevin Clan. And then Navy, and then there are alphabet people also. S, E, Z, P, P, right? Chandriya, Ashish, Vishwapriya, Bhagya, Sri Rama. So guys, we're taking a name because we know that we're doing great. And these are the normal things, normal marks, just your unit test time. So you guys are doing great. Let's keep the pace up. Let's go to your next question. All right, so your question is: a 35-year-old male with chronic ear discharge presents with fever, headache, and neck stiffness. MRI shows temporal lobe meningeal enhancement. Infection most likely spread via anatomy.
So, this is one of the direct route.
Something is there. What is it?
Yeah.
Nice. So, tegmental paradise is the right answer. Moving on to your next question.
Okay, we have Shiraj, Myra, Soumya, Juju, and RK. And Myra has the longest streak.
Wonderful.
Okay, here's your 15th question. A 35-year-old female with gradual bilateral hearing loss and no history of ear discharge undergoes otoscopic examination. The promontory appears pinkish red through an intact tympanic membrane. So this finding is known as.
Well, this finding, I would say this is a specific sign for otosclerosis.
Sorry.
Now I've given you biggie. Come on, guys. Come on. Yes.
Yeah, flamingo pink sign.
Hmm?
It's called a flamingo, right?
Great going, guys. Great
Okay, we
going.
have Shiraj,
Yeah.
Myra, Soumya, Juju, and RK. Let's move on to the next question.
The 16th question is a 6-year-old child with frequent otitis media that presents with high fever, palsy, and post auricular swelling, has tenderness over the mastoid ear protrusion and a sanguine posterior canal wall. Despite antibiotic symptoms persists, the child develops a lateral gaze palsy. What is the next best step? This is the exact question and the exact image that has been there in neetpg. So this is exactly your pyt.
Oh, what is
Oh my
what a
god.
surprise. Okay, the answer is Myring immediate mastoidectomy, but in order to do it, we need a imaging, right?
Hmm.
We can't do it directly without seeing it. So,
Remember, we got to do step by step. How does you need to preview a question? How a clinical person, like if you're diagnosing the patient, this is your diagnosis, like, and this is the complaint they're telling, and you got to think like a clinician. So you got to go step by step. I hope you guys will keep this in mind the next time. It's
no thank
okay.
for this question.
PP, it's okay. Don't worry. It's not over yet. Answer the right one next.
Okay, 30-year-old with sweet and difficulty swallowing tone audiometry due to persistent ear fullness without any discharge. The audiogram shows a cookie bite pattern with mid-frequency hearing loss. This finding is most commonly associated with.
Associated with nice. That was an easy one. All right. So Myra is on top. Nice. Then we have RK Shetty in the longest streak. So your next question is a 35-year-old male undergoes parotid surgery for a benign tumor. Postoperatively, he develops loss of sensation over the angle of mandible and lower auricle. Which nerve was most likely injured during the procedure? Same PYT, guys. We're not going to give you a clue because this is a PYT.
Yeah, right. So this now is a branch of cervical plexus.
Ready? You just you give them the answer only, no? Then greater auricle nerve is the right answer. Auricle trumpet will do it does the tragus part, so that's not there. You other guys got to read again. Chalo, let's go to your next question. Guys, we're reaching to the end. Remember, there is no negative marking.
Okay, This is the last question, guys. Okay, which of the following muscles is not supplied by the recurrent laryngeal nerve? We had asked you, I think, the previous
Previous
quiz session.
quiz. Yeah. अब तो याद भी हो गया होगा. It's an external branch of the superior laryngeal nerve.
Okay, most of them got it right.
So great.
Okay, we have Myra again, who is leading the quiz. Okay, this is the last question. Actually, this question has no points, okay? Just as a fun question, okay? You can take your time and answer.
Right. So we mean to say that Myra is today's quiz winner. So congratulations, Dr. Myra. And then congratulations, Sriraj and RK as well. So you guys have been great. And congratulations to everyone for coming up and giving up the quiz. So let's see.
Okay, let's,
Yeah.
yeah,
How are you
let's see how
doing?
the reaction is.
How are you doing?
Of what option would you choose, Rupert?
I like to keep my answers private. But I wouldn't. I would like to second you on that thought.
Let's see what others gave us the answer.
Based on
Oh,
that,
I thought. Okay, 14 of them have chosen memory issues. I
mm,
totally relate to it. Okay, the next 10 of them, I don't know what's going on. That is also very true. Okay, only 4 of them are prepared for the exam.
so at least they're happy. That's good.
Yeah, okay.
It's wonderful. All right. Eight of
So,
them are
Myra is the
very,
winner of the today's quiz.
yeah.
So, congratulations again. And congrats to Sriraj, RK, Soumya, Juju, Navi, E, CK, RK Shetty, S, Ashish, RDT, Shan Priyan, Dr. Ishaq, and Bhagya. So, congratulations, guys.
Yes. Congrats to all.
Okay, that's the end of today's quiz. So, we have completed ENT.
Mm-hmm.
And
Successfully.
remember, yeah, remember every question you answer today strengthens your concept for the real exam. So, keep practicing and keep pushing.
Remember to let's keep up the pace. Sure. Good night.